We had case study A and we interviewed a pharmacist. So for treatment alterations, we said we would delay dental treatment for at least 4 hours after dialysis, get a physician's consult, monitor vitals at each visit, and avoid sodium. And then for our dental hygiene diagnosis, we said he was AAP stage 4, grade B, generalized severe periodontitis likely related to poor OH, xerostomia, and medications. For the comprehensive treatment plan, we said periodebride, all 4 quads, 4341, with local anesthetic as needed and OHE, and then bring him back for a 4 to 6 week reeval, fluoride, OHE, Arrestin as needed, and then put him on a 3-month recall. For oral hygiene education, we wanted to make sure that he was brushing twice a day using the correct techniques, and we also recommended an electric toothbrush. And for flossing, we recommended to start off a couple times a week and then work our way up to every day. And we really wanted to use visuals to make sure that we were explaining periodontitis and the disease to him. The first question we asked was, how important do you feel interprofessional collaboration is for your patients? And he said that it is important, but often is done outside of the patient's view. He also mentioned how important it is to get to know the professionals that you trust, so that you're comfortable recommending them as healthcare providers for patients to go and see. We then asked, in general, do you feel like your patient's physical, mental, or social health affects their oral health? And he said yes, each one. He mentioned that if someone is physically exhausted or if they're depressed, then they might not be taking the best care of their oral health. And then he said socially, a lot of people eat or drink certain foods, and nutritionally, those things can be affecting their oral health as well. We then asked, in general, do you feel like your patient's oral health affects their physical, mental, and social health? And he said yes, and he had a patient who was missing all of their teeth, and he said that it affected how he felt about himself and what he thought others thought of him. And he also wasn't able to eat certain things because he couldn't chew, and so he missed out on that social aspect as well. We then asked, how often do you inquire about the oral health of your patients? And he said not very often. It is only when they come with questions about dry mouth, if they're on a certain medication, or if they're looking for something to treat their dry mouth. Then he said that he also discusses oral health when they're picking up prescriptions post-dental surgery. What he does when patients ask about their oral health or have concerns about it, he said that he always listens and tries to understand what the issue is, and then he recognizes that he's not an expert in this area and encourages them and refers them to a dentist.
Part 2 questions. We asked him, if this was your patient, what would your main goal be for treatment? He replied, trying to help him stay compliant with the wishes of the transplant team so that he qualifies for the transplant when it is available. We also asked, would you work with any other healthcare professionals to help this patient meet their treatment goals? And he said, I would seriously reach out to his provider to see if there's any point to having him spend money on medication that potentially is not doing anything. For example, if he is already on dialysis, is the diuretic really doing any good? Also, it would appear to be a duplication of theory to have both the ACE inhibitor and the ARB both being used. Usually it is one or the other. I would discuss other options for the provider to help try and lower the patient's blood pressure. I would also look to see if there were any manufacturer assistant plans available for any of his branded medications. I would also look to see if there were any grants that he could apply for to help cover the other 20% of his dialysis covered. Knowing that the patient has poor oral hygiene and that will keep him from a transplant, I would reach out to his provider to ask for a fluoridated tartar control prescription strength toothpaste and see about finding a way to get him an electric toothbrush and increase his odds of success. I would also ask the dental professional what assistant plans might be available to help with a thorough cleaning and to potentially remove the tartar staining that the patient is worried about. We then asked, do you feel like working with a dental professional could help your patient meet their treatment goal? Why or why not? And he replied, absolutely. He said that they have the ability to help him improve his oral hygiene. They can clean his teeth, remove the plaque, repair any dental caries, perform any root canals and crowns if needed, and help remove the tartar that the patient is obviously concerned about.
So to wrap up, we have part 3, the final round of questions. The first of which was, knowing this information, does it change any of your answers from before? The pharmacist responded, it just makes the care and process more urgent. However, it also means that this has been going on for a long time and the patient will need to be heavily invested in making serious changes if anything is to improve. The next question, if this was your patient, what would you want his dental provider to be aware of before his appointment? The pharmacist responded he would want them to know the unbiased truth. He would not sugarcoat it. He would also make sure that the patient was committed to improving their oral health before sending them on, since there's no sense in wasting the dental provider's time if the patient is not fully invested in their oral health. This question was my favorite. What would you want the dental provider to do or focus on during this patient's treatment? First bullet, he would try to alleviate the patient's fear of fluoride. The second one, I really liked this response. Without getting patient to buy in, no treatment plan will succeed. I would also ask the provider to take the time to get to know the patient and see if there's anything that can be done to help the patient immediately and develop a plan for future treatment, conditional on the patient doing their part of the treatment plan. In short, treat the patient like they're a member of your family. We had some additional thoughts. Overall, we thought the pharmacist had some really well thought out answers, and we have never experienced a pharmacist having so much patient interaction and knowledge, so that was enlightening, and he also had a lot more breadth of knowledge within the dental space than we would have anticipated. So us doing this experiment and communicating with a different professional created a lot more respect between our communities.